Well, how about we go ahead and start, and then when he comes on board, we'll recognize it. Good afternoon. I'm glad everyone was able to get here that is here. We'll call our meeting to order. I'm Kay Leach, and I'm serving as the chairperson for this board. With me today are several board members. I want to introduce Ashley Cranner. Ashley, you want to give us a wave? There she is. George Hageman, George. Mark Norrell, Mark. Stephen Pritchard.
Hello.
And Carol Talukian.
Hello.
And now he's with us, Dr. Bob Wren.
Hello. Made it.
Hi. So that's the health board. Also, we have with us today from the health department, our administrator, Penny Caudle. Penny. And there's Dr. Sharp. Hey, Dr. Sharp.
Good afternoon.
Dr. Sharp and Penny share a computer, so they're back and forth. And also Margie Ross. Is Margie with us today?
I don't see her yet. Not yet here.
Not
Yeah,
yet.
as I was saying, she teaches a class right before this, so I'm sure she's in transit.
Okay. Margie is from our legal department, and she'll be joining us shortly. Okay, first on our agenda today is public comment. And we always set aside some time for the public to bring comments to the board. Now, today we're going to be discussing our newest regulation about the mask mandate in public places, and that's going to be down a little bit farther on the agenda. So if you have public comment about our regulation, I'm going to ask that you hold that until we get down to that item. But if you have public comment about any other thing that you'd like to bring before the board, I'm going to let you do that now. So if anyone has public comment, if you'd raise your hand at the bottom of the screen, technical will recognize you for us. Also, we're going to have a 3-minute rule that you're allowed to speak for 3 minutes. And before that 3 minutes is up, the technical department will give us a signal to let you know that your 3 minutes is almost up. Can we have them do that little tone to let everybody know what that's like?
Yes, give me one moment, please.
Great. There's a little tone. There it is. That'll give you a warning that your 3 minutes is almost up. At the end of 3 minutes, you'll be cut off. So that'll give you time to summarize what you want to say. So if there's any public comment about anything that's not on our agenda today, please raise your hand.
Looks like there are no hands raised.
All right, thank you. Is that you, Michelle?
It is indeed.
Thank you. Thank you so much. I never know who's in technical, but thank you. I recognized your voice. Okay, next on our agenda is approval of the August 9th meeting minutes. Did everybody get a copy?
Yes.
Everybody have to go over them. They were pretty short this time. Did anybody have any comments they want to bring forth? Do I hear any motions?
I move we accept them as written.
George, I think, okay, you were muted, but you're muted now, George, but you seconded, right?
I apologize. Yes, I did.
Okay, we have a motion and a second. Let's do a roll call. Cranner? You're
Yes.
muted. Okay, there you go. Hageman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
and Wren.
Yes.
And I also vote yes. So those minutes stand approved as written. All right, we're down to an update from Indiana University, and that's Kirk White. Kirk, are you there?
I sure am.
All right.
Here we go. That's even better. Well, hey, let me just thank you for letting us get a chance to provide some updates this afternoon, number one. And number two, we've all been working COVID now for 15, 18 months. And I can't say enough about how each of you have helped contribute to the well-being and health and mitigation of suffering and death among our community. And so being a former local government official, I just can't thank you enough for your volunteer service on this board and helping us as a university community do our part to contribute to the safety as well. So let me just say that and sincerely thank you on behalf of the university for all that you've been able to do. I'm going to do a screen share now and go through my points. Everybody can see that. And let's hope that I can get through let's see, how do we do? There we go. Okay, quickly here, what I'll do today is go through how we've organized COVID response at IU Bloomington and show you our org chart so that you can see some of the players that we've had involved and will continue to have over the coming year. We'll talk about our vaccine and mask requirement, our efforts at quarantine and isolation, how we do COVID check testing, how we handle communications, how that's been key to our efforts. I'll show you our dashboard and then open it up for any questions that you might have. This picture on the right that you may have seen before was our vaccination site that we had set up at Simon Scott Assembly Hall. And we were sure proud of, the joint effort we had between the county health department. It was really your site, not ours. We just donated the space and a lot of the logistics for it. But IU Health, the county, and the university all came together on this. And it was a great benefit, I think, to the community to have this large mass site. So thanks again for that. Let's get down. There we go. So at IU Bloomington, we put together a pretty significant team to get us through all of this. It's changed a little over the year, but you'll see that our interim provost, Sean Applegate, leads the COVID response unit. Catherine Dyer from the provost's office in our auxiliary department, and along with myself, we're the co-chairs. And we have a team of people that help us. Nadia Hassan from our emergency management and public safety department does our long-range planning, done by Kate Doherty before. You may have seen Kate in some of our efforts before. And then a list of technical resource specialists. Of name notable is Dr. Aaron Carroll, that we'll talk about in a minute. Dr. Alana DeBabo from the School of Medicine, Graham McKenna, you're familiar with, and Marty Gerbig, both from our Environmental Health and Safety Department. And then our in Student Affairs, our Dean, Dave O'Gwen, Communications and Public Information, Amanda Roach. Our RPS housing group is led by Luke Leftowich. Our quarantine and isolation operation by Kyle Noonan. This large testing operation called COVID Check is run by our director of university events, Doug Boer, and his expansive team that set up all of those different sites, whether it was Arrival last year, Arrival this year, the vaccine sites, the flu sites, and our continual testing sites this year. We've got a significant contact tracing group. At one point was up over 40 people, led by these program managers. And then Dr. Beth Roop from our Student Health Center, the director there, has been a big help in advising us on day-to-day operations. And so I show this just so that you know who some of the players are that you're welcome to contact directly as need be. So to remind you all, I think you all know that we're instructing all of our IU students and employees and visitors to wear a mask indoors in public spaces. We have distributed thousands of masks, and we have disposable masks at the entrance to all of our buildings. So this continues to be a priority for us. And our students and faculty and staff are learning how to navigate all of this just today. We still have some people that are not quite sure they need to have their mask on, and we approach those. And particularly in classroom settings, it's approached just like it would be with any other classroom disruption. And our Dean of Student Staff and our Academic Affairs staff can handle these kinds of problems if they're not resolvable between the faculty member and the student. As I noticed, just as a fun fact, we've distributed over 290,000 IU logo cloth masks across all of our campuses during the past year, and we continue to distribute them so that our students have those reusable cloth masks that we tested over a year ago before we ever ordered them and found them to be pretty effective as cloth masks go. All IU students, faculty, and staff are required to have that COVID-19 vaccine and be fully vaccinated or have an approved exemption. And those are religious, medical, or ethical exemptions. And then that requirement has been upheld by the U.S. Supreme Court. And that decision we were very happy to receive back on August the 12th. Next is our quarantine and isolation operations. We've reduced the size of this a bit from last year, but we still have 248 beds set aside at Ashton Center. And this takes care of our RPS congregant living residents, which we have about 11,000 of those moved in as of today. So this is a facility that we staff 24/7. We started it in the summer of 2020 and continued it every day since 24/7, as I mentioned, with a separate staff. When our contact tracing team identifies infected or close contacts by our COVID check testing or self-reports, when that happens, then they're identified, they're contacted. The close contacts do not need to quarantine, but instead are advised to get a test, and that's under the current CDC guidelines. So we're very judicious about getting folks into isolation if they have a positive test, because we want them out of the general RPS population. Off-campus students, we advise them to self-isolate because they're in smaller spaces and they don't have the same level of exposure that they would walking around a residence hall or something to that effect. So we expect them to isolate themselves in their apartments just like any other citizens would do. In our quarantine and isolation facility, we work very hard to keep things isolated and not spread the disease. So meals are delivered 3 times a day. And I'm a guy who was in quarantine for 14 days when I got back from my overseas service last year, and I knew what it was like to sit in one place in one building in a fenced compound and not be able to leave for 2 weeks. It wasn't any fun. So meals are something these students look forward to, as well as things like recreation and in-room recreation. We've got virtual workouts that they can do that they log onto their computer. They can do workouts in their room, sponsored by our student recreational operation. And we even have some online mental health resources that they can access as well. We keep this place very clean. We've got an outside contracted service. We spend millions of dollars keeping it clean, I might add. It's been quite an effort. We call everybody in quarantine and isolation at Ashton Center at least daily and check on them, in addition to delivering their food. And of those 248 beds, as of today, our current occupancy is only 4 people. And I expect that to increase over the next couple of weeks. Last year, we got up to close to 200 at one point. We had a big Labor Day rush, bringing in a lot of people each day. It was quite a stressful time for us. But then the trend line came back down afterwards once a lot of the protective protocols got accepted and in place on the campus. So next, let's see, whoops, I passed communications. Communications really is, let's see, there it is, COVID check testing. I thought I went too fast. Now for this year, we're going to continue our testing operation, but we're only testing the folks that are unvaccinated. So we'll have on-site PCR testing at Gym 171. That's over in the Public Health Building in Garrett Fieldhouse. Our planning factor is up to 7,000 tests a week. We can do a lot more than that if we needed to, but this is what we expect to be able to do considering the high vaccination rates that we have. These are all processed in our own labs, and we have the results usually within 24 hours, often within 12. It's pretty fast operation. They spit in a tube, as you know. We process it and get the results back. They get a result back via email that they have to log in and check the results. All unvaccinated students, faculty, and staff will be tested weekly. They get a requirement to do that. They get an email every week and tell them where to report, where to make their reservation, so that we can kind of gauge how many people we're going to have by the hour each day. The asymptomatic and voluntary testing is also available at Gym 171. So anybody who wants a test, if they've been out of town, out of state, out of the country, they're feeling the sniffles. Of course, we don't want symptomatic people really at Gym 171. We prefer they go to a medical facility, but voluntary testing is available just the same at 171. Symptomatic testing is available at our Student Health Center, and we've set aside 115 appointments per day. And I think I was just looking at today's numbers, and we had about half of those scheduled for today. So people are starting to use this, and if we need to expand, we will. But we think the 115 appointments for symptomatic will take care of us here for the time being. Positive test recipients and close contacts are then engaged, as I mentioned, by our contact tracing team and given instructions about what to do next. All of our testing results, as you know, are connected to the Indiana Department of Health database. So then that adds to the county numbers as well. So for the week of 8/15, that's the latest I've got a complete summary of numbers. We conducted 2,877 tests that week before there, the week to 15th, and with a 0.90 positivity rate. Over all of our campuses last year, we gave over 400,000 tests, and we processed those through our labs, both in Bloomington and in Indianapolis. Next is communications. And what I'd say about this is, as you know, whenever you have a public health emergency, we've got to tell people what we expect them to do and what the current situation is and what we don't want them to do. And that's what we've focused our efforts on all year long and will continue to in the coming year. We've got all of these different channels that we use to communicate. When you've got a population that spans in ages from the teens to the 80s or 90s, everybody gets their communications different ways. My daughter, who is a sophomore, seldom reads her email. She says that's for grandparents. And so we have to communicate with the students often by text messaging or on social media, signage around the campus, on the doors as you enter buildings and things like that. But we know the right ways to do this, and we know what our open rates are when they open the texts or they open the emails. And that's how we gauge the different populations to get them the right information that they need and what we expect them to do. I would say that our COVID website is one of the best in higher education. It is comprehensive. It's got all kinds of resources with everything from the frequently asked questions to, what ifs, what if I come down, what if my roommate gets sick? What if I've got the sniffles? What do I do? How do I get a test? All those things. It's all on our website. And I encourage anybody to access it because of the comprehensive information that it has. The other really good resource we find is our weekly Ask Aaron webinars by our Chief Health Officer, Dr. Aaron Carroll, who's of course a pediatrician from the IU Med School up in Indianapolis. and now, of course, is our full-time chief health officer. And you can register for these. You can log on to them. And here's the aside for this, they're open to the public, of course, and he takes as many questions as he can in the hour-long time that they have those webinars. And then finally, in the community, I think you all know we do the weekly news conferences, which have really been a key to community information, which again builds confidence, trust, in being transparent about what's going on with the coronavirus. And then finally is our dashboard. We update this weekly, and it gives numbers for our vaccination rates and cases of COVID across all of our campuses, but you can split it down by individual campus. So for Bloomington, as of the 19th of August, our vaccination rate for everyone in our population at Bloomington is almost 91%. The students are at 90%, faculty and staff are above at 91.8. This is something to be proud of. As we've said, our goal has always been for it to be safer to be on campus than off. And we think that's the case with our population. Now, of course, we're very mindful of what's happening with the breakthrough cases with the Delta variant and other things, and we're keeping an eye on that. But having this level of vaccination, we believe is the key to helping us drive on with normal operations. And if you've been around the city the past few days, this past weekend, you'll see that everybody's back and going full speed. Our cases for the week, August 12th to the 18th, is 35 that have either been reported to us or ones that we have found through our COVID check testing. 30 of those were students and 5 were faculty and staff. But here's the link to the dashboard. You're welcome to access that at any time. As I say, we want the public to know where we are, and we'll continue to keep that updated. So next is open questions, if I can answer any questions for you. And of course, I'll continue to be a resource during the coming year. Thank you very much.
Hey, Kirk, I have a question, and that is, could you give us an example of an ethical excuse for either not masking or not taking the vaccine? How is that checked up, or is it simply an assertion by the individual?
I think it may be more the latter, but let me check. We haven't had a whole lot of those. We've had some, but many people first started with the religious or medical exemption, and so let me get you a good answer for that, George. I'm glad you asked it. I don't have the definition in front of me, and I don't want to quote anything I don't know here.
I have a question too.
I've got a follow-up. Can I follow up on that, Carol?
Sure. Yeah.
Could you, Kirk, do you have any information on the 10% or so that are unvaccinated in the IU community, students, faculty, and staff? Of that 10%, how does that break down between individuals that have exempted or individuals who have not yet certified one way or the other?
I don't know that. I've not seen those numbers.
Because eventually, I mean, I assume there's going to be some who have not certified one way or the other. And I'm just kind of curious how many that might be, and sort of putting an eye on, the university is going to have a challenge when it comes to people who have not exempted and they're not vaccinated. Eventually, they're going to have to take action on those students.
That's right. That is exactly right. And what we're doing at this point is, frankly, over the past couple of weeks, we've increased the vaccination rates, and we're to the point where we've got to make some decisions about how to move forward and how aggressively to move forward with the folks that, are in one of those categories, or as you say, there's still some that we don't have a good report on. But when you've got 45,000 people you're trying to herd around, it's hard to do. We'll get there.
Yeah, Mark, that was actually the same question I was going to ask for the most part. And I guess my question is, do you think we're maxed out in terms of what you're going to get out of the faculty and students? And if it were an isolated community, which it's not, that would be a great rate. Unfortunately, it intermixes with the rest of the community, and which doesn't have as great a rate. So
That's a good question. And, I think obviously we are going to max out eventually. And it gets back to that original question. How many exemptions have we granted? You can tell that it's if we've got a 90% rate, we're still at about 10% that's either exempted or we're still collecting from. So we may hit the wall eventually by the exemptions granted or the ones that we've not been able to hear from. Some of these folks we expect to be back, but may not show up. They may have planned to enroll, but they may not have actually showed up for classes. And that may be the reason they're not answering up,
Yeah. And the other question I have is actually something that we spent a lot of time on last year, and that was issues around communal living. How's that going this year with the communal living outside the residence halls?
You mean off campus?
I'm talking about fraternities and sororities, basically.
Oh, fraternities and sororities. Well, we're in a lot the same kind of situation that we were last year. They have been requested to test if they are unvaccinated. So then they're in the testing pool if they have an exemption. So the vaccinated ones are not going to be tested on a regular basis, because that's really, our determination is if you've been vaccinated, the chances are much less. And so we feel like that's manageable. But I think there's still probably pretty, as what I heard this morning, there's still several of our houses that do not have capability to quarantine or isolate on site. And so then what they do is tell their students, their residents, and it was frankly in most of these housing contracts, the fraternities and sororities had their students sign over the summer. It said, I understand that if I test positive, I've got to come up with a way to quarantine or isolate myself. And so that means going home and isolating at home, or going to a hotel here locally that has agreed to do quarantine and isolation housing. And I might add that we do have a hotel here in Bloomington that has agreed to continue to help us with that. At least one. We've got one under contract. If we have a capacity problem beyond what we're planning at Ashton Center.
Can I ask a question?
Ashley, yeah, sure.
Thank you. So we get a lot of questions, especially this board, about enforcement. And so my question to you is, since enrollment is predicated either on an exemption or vaccination, how is the university tracking all of that? Or is it on good faith? Is it part of their admission information? That's kind of that's my big question is, how are you guys monitoring all that?
Well, they have to either submit their vaccination, they have to submit their card, or they have to attest by signing a document that they have been vaccinated. If you remember, we got pushback from various authorities about us requiring documentation. So either they're attesting to the fact that they've gotten it. We've got a pretty high number of people that did go ahead and take pictures of their cards and send them in. Or they have to file an exemption. So we had, for example, with the RPS, with all of our RPS residents, we had to have an answer from these students because we had a policy in place that we would not we would not place an unvaccinated student as a roommate with a vaccinated student unless that student agreed to room with an unvaccinated student. So we had to start asking our residents, are you okay to be with a person that's unvaccinated? And if they said no, we had to assign them to alternate housing so that they would not be with an unvaccinated student. So it was a very difficult time to get through each of these individual cases and then start moving people. Caused a lot of problems, but we felt like it was the right ethical thing to do.
Kirk, I just want to say that on personal observations of mine, I've driven around through the city, and I've also sat in the car and waited on my husband when he came out of Lowe's or Menards or wherever. And I've seen an awful lot of IU students coming out. And I know they're IU students because I can tell by what they're carrying out, you know, the laundry baskets and the so forth. And they're not wearing masks. And I think they're not really aware that the city of Bloomington at this time has the mask mandate. So I'm just wondering if that's something the IU community could put out to students and make them aware that we do have that mandate at this time.
Absolutely. And I'll double check. I know we've been putting that message out on our different communications channels, but it's, you know, you've got students coming from all ends of the world, and many of them aren't used to having mask mandates anymore. And it's something that they have to get used to. You know, they'll say, well, you know, in my state, we're not doing this anymore. I'm not used to it. And we've got to get them into that habit. I agree. And I'm glad that a lot of the establishments are going ahead and putting signs up on their doors saying masks required in Monroe County and that sort of thing. I think it's a good reminder. But, you know, Sonny, I will check with Amanda on our communications team and make sure that we're continuing to push that message.
I'd appreciate it. And I'm sure they see a lot of the townspeople without their mask, and they follow example. Yeah.
And I think as they're going to get used to campus living, by having to have that mask, you know, a lot of them have them in their pockets and they'll pull them out when they got to have them, and they're going to need them, and they're needing them today in classrooms. So I think they're going to start to understand the importance.
And I just want to echo, I'd like to know more about that ethical exemption also.
Okay.
Dr. Sharp, I see you up over there. Do you have something you want to say?
Oh, I just wanted to thank Kirk. There's 2 tours in Afghanistan. I read the article in the paper today, and that's we're all in your debt. Sorry that it's turning out like it is. Very unfortunate. And
thank you, Dr. Sharp. I appreciate that.
I also want to say that IU has done an incredible job. Dr. Carroll, when he came out with his recommendations last July, maybe even June, I told Penny, that's the most incredible thing that I've seen yet in terms of addressing our COVID problem. So he did a great job. Pass that word along, and you've done a great job too. So I appreciate it.
Well, thanks. And on your first point, it's a difficult time for all of us to see the suffering that's occurring in Afghanistan right now. I wish that wasn't the case, and I hope that we can do all we can to rescue a lot of those folks and mitigate this problem. And it's hard for those of us who served over there, because we still got friends there. I do, and they're contacting me and asking for help, and I'm not sure. You know, there's not a whole lot I can do. I'm trying to get them connected to the right resources, but it's just such a mess. Hey, and I know Dr. Carroll appreciates your comments as well. We're lucky to have him, and again, he's a great resource for these discussions. So feel free to contact him at any time.
Well, we appreciate you meeting with us today. Does anybody else have questions for Kurt? Thank you so much.
I appreciate your energy
you.
in doing the right thing. The rest of the community would follow suit if you guys can set an example, and I'm liking that.
Here, here.
Thank you. We'll keep it up.
Agreed.
Thank you, Kirk.
Thanks, Penny. And oh, by the way, Penny, I'm awfully glad to hear that, our big group team partnership effort to get testing back up. Our students, faculty, and staff can go to our sites, but, our university dependents and some of our, vendors and things like that, contractors that aren't covered by our testing operations don't have that. And I think the need is there. So we're happy to be able to help along with that effort again as well. Thank you.
Thank you.
Okay, next on our agenda, we're going down to old business or old and continuing business. And first on the agenda is the regulation review. So anyone that has public comment that they would like to make regarding that, if you would please show so at the bottom of the screen, raise your hand, and then technical staff can recognize you.
There are no hands raised.
No hands are raised. Okay, let's talk about the regulation. Penny, do you know if Margie's on? I see her.
Yes.
I don't, there she is. This is Margie Rice, our legal consultant.
Yeah, so I'll go ahead and get started. And Michelle, I did send a draft over. Maybe you can show in a moment if you have that. So we have begun to get more complaints since the enactment of this new regulation. Of course, complaints have come in about people not wearing their masks, businesses not following up. We started, as we always do, and our compliance officers, we're very grateful that they were able to join us again. It really spent those first few weeks focusing on education and making sure people understood that the regulation was in place. What we found a lot of times as we went to various businesses is they just kind of strolled in to see what they were doing. And many people just didn't realize that the new regulation had went in place or that it applied to them, what those parameters were. So we have spent a lot of time, as always, about making sure people are knowledgeable. They know what the regulation is, they understand it, that if they need signs, we can help them get signs. We've done an array of signs for people that you may see around town. It always kind of makes me smile when I go to a business and I see a sign that our staff put together and it's serving a good purpose in that business. We have started follow-up site visits. So part of our process when complaints come in is that we follow up with, getting all the facts and phone calls and getting kind of all the information that we can. Again, education, that sort of thing. But as those continue to come in, it seems like maybe there's a larger problem, and we will also add in site visits to ensure that people are compliant, to get a sense and an assessment of what they are doing in order to get people to comply. For the most part, as last time, businesses want to comply and they're trying, but we are hearing a lot of people comment on being scared to put their employees in harm's way, given how angry and confrontational some people have become. We've had a few places say that we are posting our signs, we're doing these things, but that's as far as we're going because, again, of concerns for employee safety. And then we have very few, but we do have a couple who have said, we're not going to comply. We're just not going to do it. And so, again, we try to get that voluntary compliance first, and then we work through our system, which can include fines, legal involvement and that kind of thing. So we try everything we can not to go there, but we are working our process and that is in place. And it is typical of how we handle most things. We always work first to get compliance and try to figure that out. There have been noted a couple of places where people have indicated that perhaps they didn't understand, and this is especially true in two places with schools. Some people have said that they don't think that our shall means that they shall mask up because the CDC guidance and the state guidance is that you should require universal masking. Well, when we said shall, our interpretation was that that means you shall follow those recommendations and therefore wear masks. So if there is confusion in that, that may be something that you want to look at tonight and clarify. I will tell you that the states, the Indiana Department of Health has in there this last week with schools, again, went through vaccines, and it's the best defense against the virus for those who are eligible for vaccines. So teachers and those who are staff and students who are eligible should be vaccinated, and masks are there to prevent spread. And due to the transmission of Delta variant, all K through 12 schools should require universal masking when indoors during the school day. And that layered mitigation, all the things that we've been doing over this past year and a half, and now we have vaccines that we're adding to that, that those all are tools that we need to be using. So you will see in this draft that we kind of put together, there's a little bit clear language at the bottom regarding schools. And the only other thing, and this has come up with businesses, and when we talk about our signage, it says in all public entrances, and we got a little bit of feedback that they weren't posting it at all their entrances, so that staff necessarily were not reminded as they came in, say through an employee entrance, that wasn't for the members of the public. So I might suggest that we just say all entrances and not public. So that would be, so you might, let's see, let me, you can keep going down, Michelle. Thank you so much. We do have exemptions. A little bit further down, you should find the businesses and then the schools. So right there in yellow is where we have, thanks, Michelle, clear signage indicating that this order is in effect, shall be placed by businesses and public accommodations at all of their public entrances. So perhaps just at all of their entrances would make it clear that that included staff as well as public. And so then staff are reminded. And then if you scroll on down, there is the clarified language that the legal department used on down just a little bit there with the schools. So it reads, for academic and extracurricular activities, all K through 12 schools in Monroe County shall follow guidelines of the CDC, Indiana Department of Education, and the Indiana State Department of Health. If the CDC recommends wearing face coverings, schools shall require students to wear face coverings during school unless an exemption listed in paragraph 2 applies. So I think that clears that up. And yeah, so we did have another question, and just because we're on here and I talked with Margie, I will say I had kind of a duh moment. We had a question come up from a few childcares, but they are public places, and so they already fall into that mask guidance. So those are the two things that we are suggesting, and that's based on feedback that we've received, and Margie can add anything, or Dr. Sharp can add anything that he might want to add.
Penny, as I understand it, there was some question about school buses.
School buses are under the federal law, and that is a requirement for all public transportation, and school buses fall under that. So we cannot grant any kind of an exemption under that. It is a federal rule.
Yeah,
I know there's concerns. Thank you for bringing that up, because I know that there's concerns with the heat. and the high temperatures, you know, on the school buses being, you know, so warm. So I know it's a difficult spot. Hopefully the students aren't on those school buses too awfully long, but I do know that some of them can have quite a long ride. So, you know, put the windows down as best you can, ensure that students have water. And that is probably the best that we can do at this time.
Yeah, that was my understanding, was that it was a federal regulation.
Penny, wasn't one of the schools misunderstanding because they classified themselves as private rather than public? So if this said all schools or all schools, public or private, would that be a little bit clearer?
It does say all K through 12 schools in Monroe County.
Okay.
It does say that. You know, adding an extra all somewhere else may not be a bad thing. We have had a school board that we're aware of that has said that they believe it's a parent's right and that this does not apply to them. We are, again, working with them to try to resolve that issue.
Okay, this might be a too simple of a question, but further up for the businesses, you know, I walk around downtown, I see a lot of our blue stickies, right? But it says clear, back up where the highlight was. Thank you, Michelle. Where it says clear signage indicating that this order is in effect, that almost kind of implies this actual order. You know, like I've seen some communities that say, you know, in accordance to Monroe County ordinance, blah, 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 masks are required. Is that what this is saying? Or is it saying that just having a mask signage up is required?
Well,
Do you know what I'm saying?
Yeah, yes, okay. I do. I'll let Margie address that as the
okay. But I don't want to overcomplicate it. Yeah, that's what I thought of, though, that it would say that according to this order with the sunset period time too, you know, like it would say that on the doors rather than our blue little clingies. Although I like the blue clingies. But.
Well, and we didn't, I mean, doesn't specify an exact sign that you have to have. So there are a variety. So we've given out more clings, but we've got some others that we have that say the Monroe County has a mask requirement. So you'll see a variety of them. But I think that this is just saying that they have to have clear signing indicating the order is in effect. So we have a mask requirement. But Margie can address that further. She may have other.
Yeah, I don't think that we are going to be picky about what their sign says, as long as they have a sign indicating that masks are required. We did put in the language right below it that says contact the department if you're unaware of the requirements, sort of if you have questions about the details or how to comply. We can always send staff out to take a look and see what they have and clear it up.
Okay.
I think that having some signage that asks people to put their masks on is going to effectuate this order.
I know there was a store that I saw this early this week, and they had a sign, but it says it's recommended. And then when at the door, a member of the public walked in and said, "Do we have to wear masks?" And the person that was manning the door said, "It's recommended." And it said, "See, we follow CDC guidelines, which recommend." And it's not a recommendation, it's a mandate to have the
right.
mask.
That's correct. That is that advice that store personnel was giving would be contrary to this order. So certainly that may be information you want to share with Penny, and they could send staff out there to clarify it. And, you know, I will say that we're trying to give everybody the benefit of the doubt and not infer some sort of, you know, defiance on, you know, where maybe it doesn't exist. So we are working through, and I've, you know, as Penny mentioned, we've been on the phone with, you know, representatives of organizations. I've been on the phone with the Department of Education General Counsel, the State Board of Health General Counsel, attorney for the charter schools sponsor, Grace College. And we are just trying to make sure that we can clear up any confusion first, and that we can then get compliance in the, you know, with sort of the least forceful means possible. If we can't get that kind of compliance, then, you know, as Penny said, we work through our channels, and that can be up to and including filing an injunction in the circuit court. Not something that we are quick to do or even like to do. Generally, we don't like to sue our constituents in the county. But if we can't, then we, you know, we certainly are capable of doing that and will do it. But that's not ever our first you know, our first option. And I did talk with the commissioners on Wednesday's meeting and sought their permission to seek an injunction if that's something I have to do. State law now requires that. So I have the commissioner's approval to do that. And, you know, but what I pointed out there, I echoed words that Julie Thomas had said earlier in the meeting, which was, remember everybody, we are battling a virus. We are not battling our neighbor. And so it is not, again, I was just this morning on the phone with a partner at a firm up in Indy who represents Grace College, and she believes that the charter school has to comply with our local mask regulation, and just, you know, it would be a lot easier if the charter schools chartering agency would get that message to their board, and they could comply. If there's confusion, we want to clear that up first. And so we're working through it, but I want to make sure that all of you know this is something we're working on daily and we're taking it seriously. And I also want to emphasize, we have had so much more compliance than non-compliance. And Penny does a great job, her staff does a great job. We've just had, you know, very few people that are saying, doesn't apply to me.
On behalf of the board, we appreciate not only Penny, but we also appreciate you, Margie. So you've been most helpful, both of you.
Thank you.
Yeah, thanks for speaking to the difficult ones. It's
Yeah.
not always easy. Appreciate that.
And I will say that when Penny did, I don't know, Penny, if you want to share that, when you visited on site, I mean, you saw many people in compliance. So it's not as if they're even within that one case, it's not as if it's a complete, you know, it's just I think honestly a difference of opinion about where the authority lies, and reasonable people can disagree.
Can you give us an update on Ellettsville?
Yeah, I actually did talk with the attorney for Ellettsville, and she and I share, I think, the same legal opinion about the town of Ellettsville's requirement to comply. And I don't think we need the draft up. I think we can take that down. I just saw the chat. Does anybody need this draft up? Okay. So the town of Ellettsville did not vote on anything. They did not say that they weren't going to comply with the mask mandate. And so she and I think are like-minded, and she knows that we're going to be enforcing the mask mandate in the, you know, town of Ellettsville. So we haven't had a lot of complaints or problems out there, have we, Penny? Yeah. One of the things I think, you know, I've been a municipal lawyer long enough to know that sometimes I live it all day long, and then I'll read about it in the media, and it doesn't have any semblance of, it's not anything like what I lived in real life. And so you have to remember that what you might read in social media, or what you might read in the newspaper, and this is not a criticism of the newspaper, I'm just saying it doesn't always capture the nuances that you get in real life. And so I want to just emphasize, we've had very good luck with our Monroe County residents and our businesses and, our university. I want to continue to say we've had very few problems, really. And I think our numbers reflect that we have pretty good compliance. Don't you think, Penny?
And
It is disappointing that some employers have told their employees not to enforce the mask mandate by gently encouraging people to wear them. But I can see that that would be grounds for some confrontation and possibly a few cases.
And one thing that we are doing is really reassessing kind of the checklists that we use when we go in and trying to kind of figure out that balance of, it's very difficult for everything to always be perfect, right? And even look perfect, because somebody could be in full compliance and we have exemptions. So people may be in that business and be unmasked, right? And so we want to make sure that when we go in that we're assessing what they're doing and try to work with them. So they've got a sign on the door, but once somebody gets in the door, what happens? So is it clear that masks then, is there another reminder, another level of that? And do you make masks available to your people? Do you use your PA system to remind people to put their mask on up over their nose and mouth and those kinds of things? There are a lot of different things people can do, businesses I think can do, that show that they are making every effort to be fully compliant. And so that's a delicate balance, but we make every effort to ensure and help them find ways that they can increase compliance. And I think one of the first ways is not to confront somebody that, hey, you're not wearing that mask, but to say, oh, it looks like you forgot your mask. We have some for you. Things like that can make a difference. It may not work every time, but the manner in which you make that statement is certainly true. And I will also say too, all of the schools, the Indiana Academy of Family Physicians sent a letter to all the schools really stating their statement that schools needed to be masked.
Yeah, and remember too that our regulation and order has a couple of exceptions in there that may not be easy to tell if somebody, you can't tell somebody has a medical condition that they can't wear a mask, or that they're hearing impaired. You can't always tell just by looking at somebody whether they ought to have a mask on or whether they have an exception, which is another reason why we don't want people confronting other people to just be as sort of gentle. And I'm guilty of not always being the most gentle person in the world. So, but just to remind to be, as gentle as possible when approaching someone.
Well, I'm glad everything is going fairly well with our first mask mandate, because certainly COVID and the Delta variant is not going very well. And it's when we have neighboring counties rising up against the health officer and the Board of Health and winning. And we also have 125,000 children being put in the hospital on a weekly basis in this country. I'm concerned our numbers are going to go up. Therefore, more regulations and more mandates are going to go up. So, I just can't say enough how much Penny and, the work of the board and you, Margie, and IU and everybody, it kind of keeping us responsible and also honest. I think everybody's done a good job, and the children are very, very concerning for me. I just hate it. I think we had a child die here in Indiana, a cancer child, because couldn't get a bed for his treatment, and I want to see that kind of go away. So I just think I appreciate everybody here so much.
Absolutely. And we've had a few other health officers reach out to us to get a copy of our order. Others that are trying to, whether they just want to do it with the schools or whether they want to do it across the community. And I've had some health officers say, I want whether the commissioners approve it or not, I want them on the record. So it is certainly that, and I can fill you in on kind of where we are numbers and a few updates too, if you want those in a bit.
And I not talked to anybody in Owen County, but I read the information that was in the news about Owen County and how they pulled back. It's my quick take on that was maybe it was a process issue. Maybe they had not followed the new process that says you have to go to the commissioners. I will tell you that when I spoke with the Grace College's attorney, really great attorney, very smart. She represents also the Marion County Health Department, interestingly enough. So one of the first questions she asked me was, did you go to your commissioners? Did you follow the new law? And of course we did. We have an appeal process in place. If we issue a citation and somebody wants to appeal it, they can appeal it. And so that's, I totally understand why the General Assembly put that extra step in place. Constituents in Indiana reacted to COVID regulation, felt like some Board of Health who are appointed and not elected needed a check. So there is now this check. If, it has to go to the elected legislative body to pass, that's fine. There's extra protection for Indiana residents. It's not problematic for us to do that. We did it. And so I think we're totally good with our order. My question, one thing we'll need to talk about is it's written in there now that we have, that I think it expires September 30th. Isn't that right, Penny? Which is just a week away. Can you believe that time is flying? So to think about, either when we want to meet again, or do you want to extend it today beyond September 30th? That's something I think we ought to think about today.
Board members?
Well, since we have over a month to look at this, I think we should have another meeting before it expires at the end of September, which is what?
I'm like already thinking like it's August. Yeah, so we have a month and a week. Is that right?
Yeah.
Do you guys you just want to keep it as is this time?
I think that's what I was going to say. I think it can stay just as it is for now, but we set up another meeting obviously before it expires.
Yeah, gotcha.
We knew what you meant, Margie.
Yeah, in my mind, boy, I'm going faster.
Well, when you
Thank
said a
you.
week away, you got me.
Yeah, well, you guys got to keep me honest.
That's why there's a lot of us here. We can keep it all straight.
Yeah, my feeling is that we keep it like it is for now, and like Carol said, we'll have another meeting before that time, and well in advance of the deadline. So
don't we already have one
And
scheduled?
Do you have any comments on the changes that we've suggested? Are they okay with you?
I think they're just fine the way they are. The language is good, except for as long as it's really clear that all for this as cases, as long as the all includes public and private schools. If you want to add that language there, like all public and private schools.
I agree with Carol.
I think that was a great suggestion on Kay's part. I think the rest of the language you guys suggested is just fine. And with that, do you need a motion?
Yeah,
I can make a motion.
Okay. Do I hear a motion?
I would move that we accept the changes in addition to the suggestion that Kay had to add public and private schools.
I'll second.
I will second that.
We have a motion and a second. Let's do a roll call. Cranner.
Yes.
Egerman.
Yes.
Monroe.
Yes.
Richard.
Yes.
Talukian.
Yes.
Wren.
Yes.
And I also vote yes. So we'll incorporate that change.
And then Mark,
Before we leave, is there any other wording that is extremely problematic for the health department, Penny?
I don't think so at this time. I mean, we get questions all the time about certain things, but in terms of repeats, I think the language there is pretty clear. And when we've had people say, well, you know, can we sort of have this exemption? It's like, if there's not an exemption in there, remember, we are really following CDC's guidance, and their recommendation right now is all people in public indoor places should be masked, and that's what this is built around. So that's really been our stance.
Has the entrances, you know, the language for it, has it been a real problem?
Well, it certainly has come up more than once. So I think that will be helpful if we require the signs at all entrances.
Do we need to vote on that for you?
Isn't that was part of the language that you suggested already?
Oh, you suggested already?
That was already a suggestion, yeah.
All right, okay.
And then Margie, we'll have to take that to the commissioners on Wednesday, correct?
Yes, that's correct.
So just for clarity.
Okay, Penny.
Can I ask Penny? I'd like to ask Penny a question that is because I've heard somewhere that there's going to be a testing site set up again. Is that correct? And do we have any more information on that?
Yes, I have a little bit. That's kind of part of, I'm like, oh, I usually give you some updates, and that wasn't on the agenda. So we are working to reopen our testing site on Morton Street. That's not something that we can just put up in 24, 48 hours. And, you know, we were on a call with the state earlier today. We're not the only county kind of with this, and the whole state is really looking at this, right? The Department of Health set up the Optum sites and provided for those, and they closed them in June. Our grant for the testing site expired in June. And luckily, the partnership that we had with the county commissioners, the city, and the university and IU Health allowed us to keep that open through July. But I have to tell you that we never had the number of people in that site that it was set up for. And their busiest day was their last day. So
oddly, a lot of people didn't know about that one, but that's the one I always went to, because it was so quick to get in and out of there.
It was, and you know, there was lots of information about it, lots of places, but you know, that's here nor there, I guess. Right. You do your best, and it was on the state map. We refer everybody to the state testing map. You can see where all the testing sites are. It was on there. Yeah. So we are working through that. We are renewing our contracts for the space and the cleaning and the staffing. It is not a cheap venture. It is very expensive. And then, of course, we have to have the contract with the state because they are our supplier of tests and cover the lab costs and the courier services and all those kinds of pieces. So we are working through that. The state is also starting to do some strike team testing in a different fashion than they had done before. So we've been trying to figure out if there's a way we could get that here before we can get our site open. I don't know if that can happen or not, but we are hoping to have our site up by the 1st of the month. Earlier, we would like to have it open tomorrow, to be quite frank, but that's just not a possibility. And there are lots of reasons why it closed, including funding. So, but we've worked through that, and the timing was just unfortunate. And, you know, that's what I can say about that. So we are working through that. We're also, as you know, it probably heard today that Pfizer did receive full approval for I believe it's 15 and up. Well, where was my note on that? And we're awaiting then more kind of direction on some of that. So that's a good thing. Hopefully those folks that have been waiting because they wanted full approval, hopefully that will be what it takes to encourage them to go ahead and, you know, and be vaccinated. Right now, we stand about 58% of our eligible population is fully vaccinated. So vaccine uptake did slow down. We are getting ready in September. We go into the schools. I think I mentioned that. So we have a lot of school clinics scheduled for flu vaccine and COVID vaccine. We have had 3 deaths in the last 2 weeks, I think it is. So certainly this is not something to think it's over. It isn't.
Penny, can I ask a question about that? Have we had any deaths that you know of that would include a breakthrough case?
I am not aware of any that we have had. There have been some breakthrough deaths in the state, and that's kind of really what we get. Hang on, I'll see if I can find that.
But that probably wouldn't include any information on the age of those patients or those people. And
yeah, I can tell you that so far, our 50 to 60 age group, I've seen some increases in that if you watch that dashboard, but all of our deaths so far have been in people 50 or over.
I read something very recently, and I don't even know where I read it, but it said the deaths in the state for breakthrough was 70 years old or older. What I read.
Yeah, you can look, the dashboard has a lot of that. I have one report up, but I'm not finding that specifically. In terms of the surge, I can tell you that the week of July 22nd, 29, this isn't deaths, but child and teen cases jumped 84%. But the deaths, breakthrough cases, deaths, and this is a little bit dated, but there had been 78 deaths out of the like 3 million fully vaccinated. So very small number. I mean, everyone is important. I'm not, but in the percentages, it's still, you know, like 0.003, I think.
A lot better than the flu.
Yes.
well, then you add in, the only reason I was asking was, you know, people will say, I've heard from a couple unvaccinated people, well, you know, now people are getting the vaccine or dying. And I said, well, yes, but, you know, also if they're
Not really.
quite elderly, I mean, you know, you don't really know. It's usually a complicating, a mix of things that probably added to their death, you know, I mean, age being one of them. You know, so.
Well, I went to the state's dashboard. So out of 9,922 breakthrough cases, that is 0.327% of our vaccinated. And breakthrough deaths, there have been 83. 95% of the deaths occurred in those 65 and over, and the average breakthrough deaths is 80 years old.
Yeah. So speaking of the breakthroughs, you know, there's a lot of talk about boosters starting at 8 months after your last dose. Is everybody going to be ready to do this? I mean, that's a lot. Because everybody I know that, you know, whenever it's available, that they're going to want to get that third dose. And
yeah. Well, we did have a call about it right now. Certainly they're talking about it. We're kind of revisiting our plans. It's a different landscape than it was in January when we first started, because there are more options. But at this moment, we don't know what that booster is going to be. So we don't know if it will be the exact like a third dose, or if it will be different in some fashion. So we are still waiting on that, and that will certainly make a difference in terms of how we can react. But we are, looking at that. And I have to tell you, because of the change of landscape, setting up mass clinics becomes harder because businesses are open. And so there's less availability sometimes of large spaces, but we will figure it out. We are, just because even of the third dose, we are looking at expanding our availability on Miller Drive for vaccines, as well as having the school clinics going on. So we are looking at that, but I will tell you, we won't be able to do it without the volunteers like we had before. There's just no way.
And as an aside about something you talked about, now that they've approved the Pfizer vaccine, I read somewhere recently that 30% of the people who have decided not to get the vaccine are willing to do it once it gets full approval. Mm-hmm. So hopefully it will help. I mean, we'll see if that's true or not. And I can't remember where I read that, but
I wanted to add a thought to that. And if you recall, the Indiana legislature, when they said you can't ask somebody to prove that they're vaccinated, part of their rationale was because it only had emergency authorization. So now that it has full authorization, shouldn't the legislature go back and say, okay, you can ask Indiana University, you can ask students, faculty, and staff to prove, to show a copy of your card. The problem with that, though, is that it was only Pfizer that was approved.
Right.
And you've got a mix here, Pfizer, Moderna, J&J, and how do you administer that at the university? If the legislature said, oh yeah, you can ask if they've had Pfizer. So, but anyway, that's something to think about, is at some point, should there be an advocacy back to the legislature to, these vaccines have had full approval, change your policy.
That's a good Margie Rice thinking question.
Yeah, I think, and that's an excellent point. I think that when we do have a county lobbyist who we work with year round. And so that's certainly a feedback I can give. I owe him a call anyway, so I will definitely pass that along. He knows what's going on. Our lobbyists represent Lake County and Hamilton County. They're proud to say that they represent the largest Republican and the largest Democratic counties in the state. And so they feel like they have a pretty good handle on what's going on. So I'll pass that along. Good feedback.
That's a good thought, Mark.
Well, that's just another, how to say this. The university is doing such a great job with what they did towards the end of the last academic year, with just flooded the place with mitigation testing and just did a fantastic job. And then we're so close, and the university said, okay, upload your card and then cut off at the knees. Like, come on.
Yeah. The other thing that when you do find out about the testing site, when it's going to, if you could let us know, I mean, I'm sure that everybody else on the board has the same experience I do, where people think I know a lot more than I do. And I've been getting calls about the third dose, like, where you go get them and that kind of stuff. I've actually had to tell doctors' offices where they can send their patients to get them, which is kind of interesting. But I fortunately did figure it out. But so if you could let us know, that kind of information as soon as a quick email, because we get questions, and I'm sure the rest of you get the same questions as I do about stuff that's going on. And I want to have up-to-date and accurate information to tell them, instead of saying, I don't know, but I'll go figure it out. I'd rather actually be able to tell them.
Yeah, and with all vaccines, with that third dose, first recommend that they talk to their doctor to make sure that they're on that list and eligible, and then ourshot.in.gov, and they can find all the available testing sites or vaccine sites. They can find testing sites too, but they can find the appropriate vaccine site and make an appointment.
It's just fun to be able to tell them that they have Moderna Mondays at the public health clinic. Yeah.
I love that, Moderna Mondays. Yep.
Yeah.
I know.
Okay, are we up to budget update, Penny?
I think so. So just a couple quick things. We submitted our final budget, and in talking with the council office, Ms. Shell. We had omitted our longevity in the 1206 in the Indiana trust account. So that's been put back in, $600 added to that. Again, it's part of the personnel that it's kind of part of that benefit package that we've got to pay. But I wanted you to know that that line for some reason on the form had been omitted. And so wanted to make you aware of that. We have put it in so they are getting all of their benefits, or will be. We don't want to short anybody any of that. And then we had some discussions about equipment and the ground penetrating radar for finding septic systems. So we went back and forth a little bit on that. That money we ended up putting back into our budget. So that is in our equipment line now for the 2022 budget. So we should be able to purchase that, but that does increase that overall budget by about $12,000.
Great.
And Margie, I mean, those are changes, but they are things that we've essentially talked about. Should we go ahead and do a vote that they are good with those things, or do you think this discussion is adequate?
I would have a vote, then there's absolutely no doubt about it.
Great.
Do I
So you
hear a
need-
motion?
I move that we accept the things that Penny just talked about. How's that for our motion?
Do I hear a second?
I'll second. George
Thank you,
Hageman.
George. Okay, let's do a roll
Always
call.
like to.
Cranner,
Yes.
Hageman,
Yes.
Norrell,
Aye.
Pritchard,
I think so. Yes, I do.
Talukian,
Yes.
Wren,
Yes.
and I definitely vote yes. So that has been approved. Board member comments.
Just a thought. I think it helps if you let people with whom you speak about the virus and the immunization process and masking to let them know we're dealing with a very new virus now. And that's why everything's trending upward in a way that's so alarming. And people don't seem to appreciate that as much as they should.
Yeah, I agree, George.
And gathering
I think-
information on effectiveness of the medications and the epidemiologies takes a lot of time. It doesn't happen overnight. And people want quick answers. It's going to take a couple, 3 years to solve some of these problems. But the public can't wait that long.
Let's hope the next variant is less virulent, but it could go the other way too. So let's hope not.
That's the one I've read about most. The next one is the Lambda. Is that how you say it?
Lambda, right?
Is that in Indiana, Penny?
I don't think that I have seen that it is off top of my head. So far, it has not been a variant. I think it's not classified as a variant of concern yet. They're just watching it. But that can change from day to day and week to week. So when I say that, I want to make sure that caveat is there.
When I read about it, it sounded as bad, if not worse, than the Delta.
Well, as long as we have the great unvaccinated petri dish out there, it will continue to evolve.
Lambda is not listed on the state's website as of yet. There haven't been any cases that they've put up.
Well, when viruses evolve, they never get less infectious or less virulent, with very few exceptions.
Okay, any other board member comments? Let's talk about our next, Margie, you have something?
No, sorry, no, I'm good.
Okay, let's talk about our next meeting date. If we go 2 weeks from today, that'll be around September 13th or 14th, in that neighborhood.
Margie, are we still in budget hearings? are you still in budget hearings then?
Yeah, I'm looking at my calendar. I have a noon meeting, and we do have budget sessions that week.
Do we need to meet that week, or just putting out for 3 weeks be better?
I know I will not be here 3 weeks away or 4,
Well, 2 it is.
but well,
Actually, the 13th is actually 3 weeks.
Yeah.
Oh, it is?
it
Yes,
is.
Oh,
yes.
Well, how about the
Yes, it is.
6th or 7th?
the 6th is
Is
Labor Day.
Okay, how about the 7th or 8th?
I could do either one of those.
7th is okay with me, or 8th.
Okay, I'm gonna be out of town, and so I will make every effort to make that meeting, and it'll have to be I'll just have to let you know, I won't be here at the time, so I'll let Penny know.
We'll still be virtual then, right?
Yes.
That's still okay.
Yeah, virtual's good through when?
Well, we don't know exactly. We've been told by the public, it's as long as the governor keeps extending it, we are good.
Yeah.
So we've been told that we're going to get at least, like a month lead time before we have to quit. So we're just kind of watching as we go. What day are you guys thinking? Are you thinking the 8th? Is that what you're thinking?
It's 7th or 8th, yeah.
Okay, the 8th, I have another board meeting that I'm running, and it starts at 5:30.
That wouldn't be a good choice then.
What if we did 3 o'clock again on the 8th?
Okay,
And you could leave if you had to, Steve.
okay, well, that's 2.5 hours, so hopefully that wouldn't
Yeah.
be a
Yeah.
problem.
That's one of the good things about having frequent meetings. They don't take as long.
Okay, how about September 8th? Can everyone be available at 3 o'clock?
I can be available, yeah.
Ashley, is that okay with you? Okay, let's say, Margie, that works for you?
Yeah, it sure does.
Penny?
Yeah, I can make that. Yes.
Okay,
Couldn't
Let's
figure out
say
if I was muted or not.
let's say September 8th at 3 o'clock.
Great, thank you.
Thank you.
Sounds good.
Dr. Sharp, anything you want to add? Are we on track?
Yeah, I think so. We have a 2 o'clock meeting on Wednesday. 2 o'clock health with IU and the hospital and all that stuff.
On a Wednesday?
Yeah, every Wednesday.
He's just saying that we have a 2 to 2:30 meeting on those days.
Okay,
So 3 o'clock still okay?
Probably.
Yeah.
Good, so you can get some feedback from Kirk on, he said he was going to look up some information about those who had received an ethical exemption, some examples of that, and also what percentage of the unvaccinated / uncertified, how that breaks out.
Also,
That would be appreciated.
how often they get mitigation tested.
Yeah, I really enjoyed his update today. I wouldn't mind having him give us regular updates in terms of how things are going on campus, because it's early. They've only been there for a week. Things could really change in a couple of weeks. They changed fast last year.
Right.
That was very helpful.
Yeah.
Yeah, it was great. I would love it if he or someone else could do that again.
Okay. And in terms of the Greek houses, we are working with them this year because of the vaccinations and the varying levels. We are just assuming we are going to have to work with them house by house and case by case, because there's no way that you can estimate a number that, it's going to be different based on their situation. So
Aren't they supposed to be reporting their occupancy arrangements and stuff to the Office of Sword and Fraternity Life?
yes,
Okay. So are they actually doing that? Do we know?
they do. I think some, their occupancy, yes, and their plans. And I think that's what Kirk was saying, that some of them, their plans are, we we don't want to have you here. We want to have you elsewhere, which is in line with what a lot of them did last year. I think the problem that they will have this year is that hotels are open. And with games and activities back, they are not going to be as accommodating because they're going to have other business.
Yeah.
So they're going to be competing with that, I guess is what I'm saying.
So do we have any, because one of the things we've said, if they had a 100% vaccination rate, they could have a higher occupancy rate. Do we have any idea how many are complying that or requesting that, or?
None of them, well, I mean, right now we don't have a regulation. We have recommendations for them. So there isn't an exemption process because it's not a regulation. I think all of them have less than, I think, the 90% occupancy. I don't know if I've talked with Leslie, we're rescheduling all of our meetings. So none of them are over that 90%. And I think some are a little bit less. I think the challenge for them may be really knowing for certain within the house what their percentage of vaccination is. You know, whether or not people share that fully with them or not.
I thought they were regulations, not recommendations. The last one we passed. They're just recommendations, really.
Recommendations. Mm-hmm.
Okay, anything else? Then we'll get together again on September the 8th at 3 o'clock.
Great, thank you, guys.